Reports on testing is going to start changing. We now have at least 3 labs starting to do some testing here in Kentucky. We're getting results from LabCorp. We're getting some results from U of L, and we have our state lab. Now, until we have a certain number of positives that come from each of those labs that we then check, it's mainly presumptive. When they give us data on a positive test, we are going to treat them as positive tests. That may mean that there is a time where we come back and say there's one less positive, but we don't anticipate that that will happen. We're also going to start getting numbers in at different times and sometimes faster. For instance, tonight we don't yet have in the 27 tests that we are conducting in the state lab. We will put that out via a statement on social media later tonight, because we won't have any additional details other than the number of positives and negatives there. What I can report is that we believe that there are 2 more positives today, at least 2 more positive tests for the coronavirus. We believe that they are in Jefferson and in Fayette County. But again, the numbers are going to change, and the way we get those numbers are going to change as we move forward. Our understanding is that both of the 2 individuals are isolated. We believe one is in a hospital and one is at home. Again, it's important as we take major steps to stop the spread of the coronavirus that we all remain calm and that we do everything that we can to help our fellow human being. And that's the 2 duties I keep talking about. Number 1, protecting yourself and your family by using good hygiene. And number 2, making sure that you're not spreading the virus, because you could be asymptomatic. Before I talk through some of the steps that we're taking, I wanted to ask Dr. Stack, using a slide from a paper that is about what Seattle has faced, to talk a little bit about what we are trying to do with so many of these recommendations. Kenneth, can you put that up? There you go.
Great. Thank you, Governor. We're going to do a little science here real quick. So people wonder why, when we just report a few positive patients, we take such significant actions, and this is a good example why. So for the media, we have the resource for this if you'd like it, and you can ask communications for the details. But these graphs, so the top one shows total number of infections in the community, and the bottom one is people currently actively infected. These are researchers who took the data for what's happening in the 2 counties near Seattle, Washington, in real time, a paper from March 10th, so just a couple days ago. What I want to show you is this blue curve at the top is what happens about 3 weeks after patient number 1 if you do nothing. The curve beneath it is if you reduce our social contact with each other by about 25% from what we typically do, the line drops dramatically. If you drop it to 50%, the amount of contact we have with each other as people, you go down to the green line. And if we didn't contact each other at all, you never have an epidemic, because disease doesn't spread. The reason the things we're doing, which are so understandably challenging for people to accept at times, are necessary, is because if we do them quickly and we don't delay, we have the best chance of keeping ourselves as close to that red line as possible and not having this disease take hold in Kentucky as badly as it could. And if you see what's happened near Seattle, I think or in Italy or in China, all of us want to get that as close to that red line as possible. And I keep saying this, but I could not be more grateful for the actions Governor Beshear is taking. I think they are exactly the kind of things we need to do to help keep Kentuckians as minimally impacted by this as we possibly can.
All right, so to recap steps that we have taken here in the Commonwealth, and I'm doing this so often I'm starting to lose my voice. I've declared a state of emergency, and that has already come in handy. It gives us tools and funding that we wouldn't otherwise have to address this coronavirus. We've activated the State Health Operations Center that communicates with all the local health departments, as well as the Emergency Management Operations Center that communicates with the county judges and the emergency management in each county. We're working with all 120 county judges to keep them updated and to work with their emergency management network. We've initiated changes to Medicaid and filed an executive order on private insurance to waive copays and fees. Anything we believe as testing becomes more available might be an impediment to people. We've issued the executive order to prohibit price gouging. So if you see people trying to gouge, whether it is sanitizer, cleaner, anything else that they may need, call that hotline number, 888-432-9257. We have issued, if you can put back up the website, Kenneth, we have put up this website. Again, it's really important that we drive people to this website. It is the preeminent place to get information here in Kentucky. It's updated often. It's kycovid19.ky.gov, kycovid19.ky.gov. It has guidance. It has guidance for how to help somebody who is in self-isolation, the things to do and not do. It has information for counties with positive tests. It has guidance for prisons and jails. And every piece of guidance that we're going to put out, we are going to put up on that website. We have our coronavirus hotline that's up, 1-800-722-5725. The infographic that is on this website is incredibly important to remind people every day. When you saw the curves that Dr. Stack was talking about, it is very important that we don't overwhelm our healthcare systems with people who are well. We got to make sure that our healthcare system is there for people who are sick. So if you are well, but you are nervous, call the hotline. Don't go to a healthcare facility. If you have a cough, maybe allergies, if you're sick but otherwise would not have sought medical care but for the scary coronavirus that's out there, again, call the hotline. Don't overwhelm our healthcare facilities. But if you are sick and would have sought care or you are injured, please do so. This is really just being about a good neighbor. It's understanding that we are all in this together and making sure that we're using our resources to help those that need our help the most. We've published the CDC guidelines with warnings. Those include individuals over 60. Do not go to places where there are large crowds. It identifies those that are especially vulnerable, those with heart, lung, or kidney disease, compromised immune system, those with diabetes. And for certainly those populations, but we're getting to where it's for everybody. Don't fly. Don't get on a cruise ship. We provided strong guidance to nursing homes and long-term care facilities to restrict visitors. We have done the same with our state prisons, fully restricting visitation. We provided that advice to jailers from around the Commonwealth. We hope that they are taking it. We have an executive order that allows pharmacies to refill prescriptions up to 30 days. People are going to start needing this with the strong guidance to avoid crowds. We're ensuring that we have the paid sick leave that we need here in the Commonwealth, even if you just started and as a state employee are just accruing your sick days. We've closed all state prisons to visitors. We're now encouraging all Kentuckians, especially those over 60, but all Kentuckians to avoid crowds. That doesn't mean that you can't and shouldn't be with your family. It doesn't mean that you can't stand 6 feet apart and talk to your friends. It certainly doesn't mean you can't go outside, because you should go outside. It's healthy, and we want you to stay healthy during this. But again, that social distancing is now the absolute critical phase that we're in. It's how we make sure we don't have that really steep line that Dr. Stack showed you. It's how we make sure that fewer people get this. We've asked for groups that are holding events where people would come together to cancel them. And we've asked all different types of community events to do so. When I first provided this advice, I certainly didn't mean to seem like we are singling out houses of worship. We weren't. But I know that that was one of the pieces of advice and recommendation that received some of the most attention. But it's really important. It is really important that we avoid spreading this coronavirus. And we know that for 2 of our Harrison County individuals that tested positive, the direct link with them is that they go to church together. Once again, I do not believe whether you go to church this weekend is an act of, or a test of faith. I believe that God gives us wisdom, and that wisdom compels both our medical experts and myself to recommend that you stay away from large crowds, including those at worship services. Now, everybody who has the ability to do that worship service virtually, call in your radio station, maybe your public access or others, please do it. This is an important part of my life. It's an important part of so many lives. Let's just try to do it in the safest possible way. We've suspended state travel for most state employees, and we've asked people certainly that are coming to work, if you can telecommute, do so. Your employer ought to let you do so. And for those that are in the work environment, spread out as much as you can and practice really good hygiene. We haven't been saying this enough at the last couple. Wash your hands with soap and water for over 20 seconds. Disinfect surfaces and your home. If you're worried about supplies, soap and water is better than the hand sanitizer, and you can use a 1-100 bleach solution to sanitize your home. So now, as you noticed, our acting commissioner of the Kentucky Department of Education, Kevin Brown, is here today. And that's because, with advice from Dr. Stack and others, effective Monday, this coming Monday, we are recommending that Kentucky's public and private schools cease in-person classes for at least the next 2 weeks. For those that have a spring break in the third week, we think that you should take that spring break. In other words, you should cease those in-person classes all the way through that spring break, which would give you a total of 3 weeks. It is a big but necessary step. And announcing it gives our superintendents, principals, teachers, and parents time to prepare. And it will give our schools the time to provide the at-home assignments and guidance that are needed. And now we're giving this advice with flexibility. The reason that I'm using the words ceasing in-person classes is that we want superintendents to have the flexibility to keep open cafeterias. If they're going to deliver meals, we have to make sure that we continue to take care of our children. Our Friskies are so important in the services that they provide so many of those families. We want to give our school and school systems the maximum flexibility to continue to help so many children and families that rely on us. I know it's going to create a big challenge because there are a lot of kids that don't necessarily have the same system at home that my family might. But we want to try to give the maximum flexibility for us to provide the services that those kids need. I'm going to invite Kevin Brown up to make a couple of comments, but let me say that this is a necessary step, and it's one, again, though, that should not evoke fear. We are going to get through this. We're going to get through it together. The reason that we're going to get through this is we're going to be aggressive about the steps that we take. What we want to do is to protect the most vulnerable, and while kids seem to be okay, they don't seem to manifest symptoms, and they seem to be really safe from the coronavirus. We do believe that they can spread the coronavirus just like anybody else, and this is another critical step to take on social distancing and what we are trying to do to protect the most vulnerable. So, Commissioner Brown. Yes.
Thank you, Governor. I strongly support Governor Beshear's recommendation that all schools close for in-person classes beginning Monday, March 16th, in order to prevent community spread of COVID-19. I know in-person classes is not a term that some of our superintendents have heard, and so I anticipate a lot of questions tomorrow, and we are going to be happy to field those superintendents and local boards of education as we move through this to how we can be creative in the public school community in reaching these challenges and using our school resources to do so. I want to thank the governor, Dr. Stack, and others in the administration that have been working tirelessly over the past few days to ensure that we take a proactive approach to this issue based on science and research. As you've heard, school districts may choose to utilize non-traditional instruction, that's the abbreviation is NTI, for these days if they have been approved to do so by the Kentucky Department of Education. NTI instruction is an option and it is not required, but it is strongly recommended. Some districts have not been approved for this school year for NTI. However, we have opened a waiver process. I'm going to be asking the State Board of Education at their special meeting on March 18th to grant a waiver to permit school districts that want to take advantage of NTI instruction as a result of the COVID-19 closure to be able to do so, so long as they provide the Department of Education an abbreviated plan with details on how they will be providing that instruction. We've heard from over 20 school districts in the last 3 days, and they've already been submitting to us very detailed plans for how they're going to be delivering this instruction. On Monday, I asked the U.S. Department of Agriculture to grant a waiver to Kentucky to permit school districts to provide non-congregate feeding during school closures. If granted by the USDA, this will enable districts to be reimbursed for meals that they choose to serve to students on school closure days. This may be done by pickup in the cafeteria. It may also be done by delivery of school bus or other creative options that we're going to be working with our school districts to provide these meals if they so choose to provide that resource. All day tomorrow, I'm going to be convening the Kentucky Department of Education leadership team to provide direct consultation to superintendents and other education partners with questions about school operations affected by COVID-19. We will be developing a public question and answer document related to these operational issues that are related to school district operational functions. And school districts, as you're listening, of course, questions regarding the public health aspect of COVID-19 need to be continue to be directed to the public health departments and your local health departments. I want to channel the governor's advice to the Commonwealth over the past few weeks. I continue to remind our K-12 education community to follow the 3 C's. Calm, stay calm. You are leaders within your community, school superintendents, Board of Education members, and all school personnel. Be clean, practice and promote hand washing, and cooperate. Continue working with your local health departments as we address these issues. I also want to send a special message to the girls that are traveling home from the high school athletic tournament. I know that's going to be a disappointing ride back home. I want to thank Commissioner Tackett for making the hard decision to call off the rest of the high school athletic tournament as well as the boys' Sweet 16 tournament. Thank you for your leadership. To the boys and girls that would have played in that tournament, you truly have taken one for the team, for Team Kentucky. We will work after this is over to see that we have a make-up state tournament. And I know that the Kentucky High School Athletic Association, they're already in conversations about this. So thank you again, Governor, and school district family. We're here to support you at the Department of Education.
Let me mention 2 things. Number 1, for those watching, we are having a thunderstorm outside. If that cuts the feed, it's just a thunderstorm. Again, remain calm. That's something, if people were watching, might react differently to. The second is, it's important that kids go to school tomorrow. I'm the dad of a 9 and a 10-year-old that I love more than the world itself, and I will be sending them to school tomorrow. That's going to give them the chance to get the resources they need to take home, because it's already past school today, to where they can have instructional materials over the next couple weeks. So again, that is our recommendations today. We're going to be back at 9 a.m. tomorrow. We'll provide an update tonight on any more positive tests. But let me say once again, we're going to get through this. We may have to take some more steps as we move forward, but Kentucky, we can take it. If we do the right things, we can protect our neighbors. We're going to be okay. So as kids are home more, remember, you don't have to just hunker down in your home. You can get outside. You should get outside as long as there's not a thunderstorm like is going on right now. Spend that time outdoors, and it's okay to enjoy yourself during some of that time, and try to enjoy as much of it as you can. But remember that social distancing is what we're trying to do, and we need your help to do it. So with that, we'll take questions.
Governor, this is a question for you and maybe Dr. Stack as well. We talk about flattening the curve, not to necessarily stop the disease in its tracks, but to slow the spread. And we're seeing the cancellation of events in our schools to ensure that hospitals can build up that capacity. How much time do hospitals have to make sure they have adequate resources? And do you have an accounting of how many beds we have in the state?
Well, if you could, Kenneth, can you put up the graph that Dr. Stack showed earlier? I think flattening the curve is very important, but I think what we're trying to do with social distancing and limiting contacts is truly best shown by this case study of Seattle. And if you look at the difference that we can make by cutting a quarter to a half of our contacts, it's going to make an enormous difference in the spread of the virus, but it's also going to make a big difference on the demand for our healthcare system. And again, this is both an attempt to prevent a shock to that healthcare system, a spike of individuals, but it's also going to take us knowing when not to go to a healthcare facility. If too many of us panic and go when we're otherwise healthy, that means there are less resources available to those that are truly sick.
To the Commissioner, I know some districts, and Fayette is one of them, we're not part in Fayette County of NTI, of the online learning. The school board chairwoman is concerned that 60% of the kids are in poverty, so they don't have access necessarily to the internet, to digital devices at home. Have you been in touch with Fayette or these other districts to ask what they might be doing during this downtime?
Thank you for the question. I have been in touch with Fayette County. I actually had a conversation with Superintendent Kalk about an hour ago. He has his team and has had his team working all week long to be able to provide resources to the students in Fayette County in the event of a closure, whether or not they are an NTI district. They, I believe, are planning to submit an application maybe next week to us. And I would remind folks that the NTI instruction, while it is ideally through technology, the districts that do NTI now understand that some students do not have that capability at home, and so there are packets that are provided or that can be picked up at community locations or at bus stops, and so when they submit application to the department for NTI, all of that planning and how they will deliver those services are in those applications and in that plan.
As of today, how many districts across Kentucky have told you that they'll go ahead and suspend classes as of Monday, and do those districts include Jefferson County?
Many districts anticipated that this announcement was coming. The governor was very gracious yesterday to have a conference call with all superintendents as well as various support organizations, and so they anticipated that this would be coming at some point in time. They were prepared for this. As you all know, superintendents prepare every day in the wintertime, particularly for winter closings, flu, and so they're prepared for this. We have 83 districts currently that are approved NTI districts. We've received approximately 23 to 24 applications to take advantage of the waiver that we think the state board will approve next week, and I believe we will continue to have applications that come in as district staff, central office staff, and teachers continue to work on their applications. Even after Monday, after the closure, they may continue to submit applications.
JCPS committed to suspending classes?
I know, I'm sure Dr. Polio is committed to do what's in the best interest of the students in Jefferson County. I know him very well.
I think he has a press availability later tonight, too.
How many districts have closed?
I believe we have 4 districts. Harrison County, of course, is closed this week, and I think we have 3 to 4 districts, and they're mainly in the cluster of Lincoln County, Garrett County, and Boyle County, I believe, that have closed.
Governor or Commissioner, what information do you have on the 2 new cases? Do you have a gender and or an age range?
We'll be able to provide that tomorrow morning. We are just getting that information in, and then we'll be able to provide any additional detail on testing that we get tonight.
The fact that there are cases that Lincoln, Garrett, and Boyle County schools are all close together, they've all called off classes. Should we look into that there's some people that have been tested?
I don't think that you should. I think that what it means is that they are taking the steps that they need to for the social distancing that we need to be doing. Let me add that under our state of emergency, we'll do everything we can to ease the financial burden of our school systems that are out there. And I know that there's going to be a lot of questions from those school systems, and some of them we're going to have to be answering as we go. But this is obviously a new challenge, but we are up to it, and we will give the best answers we can as we move forward.
I have a follow-up. Phil asked a great question, but I want to ask a follow-up to my question, which is, do we know if this Jefferson County case is the Anthem case that we had all been hearing potentially was going to pop today?
You mean the Humana case? That is the presumptive positive that we are reporting as the Jefferson County.
So it's not like we may have 2. It's the one.
Correct.
thinking was coming.
Correct. But we're going to have, I didn't say this time, we're going to have more positive cases. And you ought to expect more positive cases, certainly in Jefferson because of its large population, in Fayette. But folks, we expect to see cases all over the Commonwealth. That's why we're doing what we're doing. And I hope that areas don't say, well, we haven't had a case, so we're not going to take these steps. That's the exact reason to take these steps, limit those contacts, and hopefully prevent further spreading in any area. Remember, about 80% of people, we believe, that get the coronavirus are going to be just fine. They might be asymptomatic. They might have small symptoms, but they could still pass that on to the most vulnerable.
When it comes to people who've been exposed in other countries, officials have made sure that when they're isolating themselves, they're not doing it at home, they're taken to another facility or building. Obviously there's a concern about civil liberties that enters into the equation. But can you provide some guidance people should have when it comes to self-quarantining so they're not putting their family members at risk?
Kenneth, can you pull up the website? We got it right on there. Let's see. We have home quarantine guidance that is right there on the right. That is the official advice. It's a PDF. You want to click on it, Kenneth? There you go. Again, we believe, provided that it's done correctly, that self-isolation, especially if you're not showing symptoms, or we have some in self-isolation right now that are doing all right, even though we know they have the virus, can be effective, and it's going to be something that we're ultimately going to need people who are well enough to do.
Would you recommend that family members leave for a certain period of time?
What it talks about here is that you need a separate room. You need to limit contact with probably a single family member, and then just different steps on cleaning. Remember, we still believe it's communally spread. Everything that we talk about being 6 feet away at work can also help at home. I know that's hard with your children. That's one of the reasons that we're taking the steps with school that we are to help prevent that spread, because kids are never going to stay 6 feet from each other or from you. I'm going to continue hugging my kids every single morning. We just want to make sure that they are not ultimately spreading this to the most vulnerable.
I have a question for Dr. Stack.
Yep.
I imagine this is not your first public health emergency, so I'm just wondering, how does this stack up, no pun intended, with the previous ones? I'm sure you've never heard that before, that you've dealt with before, and how would you gauge the response compared to ones you've seen before?
Well, whatever the prior experience is, I would say this is an experience worldwide we've not had before. We've not had a virus like this spread this particularly fast. I mean, you have to go back to like 1912 and probably the Spanish flu kind of stuff for a situation that's similar. But we have science and technology and evidence that we can use now that they didn't have. So now we have a chance. We can learn from history, and we can use science and data like I showed you. You had another question I think I didn't answer. Did I get you? So as far as, how's our response? I apologize.
Compared to what you've seen on these.
I would say the governor has quoted what the World Health Organization said, that when you look at the whole world, and there's probably over 110 countries affected now, that there was a concern about an alarming sluggishness in the response. I am very proud to say Kentucky is not one of those places. I think you've heard a steady stream of progressively more interventions done very quickly and with little hesitation. But while there's little hesitation, let me assure you, there is intensive planning. The fact that we have implications for a lot of other things people rely on is not lost on us. So like I said at a previous conference, none of these recommendations are taken lightly. I know the governor takes every single one of them with great care and with the best advice he can obtain. And we're working in partnership, with my fellow commissioners and other cabinet secretaries and with the governor's guidance to try to do this in a way that gets all the benefit we can get to keep people safe while addressing all the possible other consequences that we realize are going to occur as a result.
Let's take one more.
Commissioner, if I can ask real quick, the end of 2 weeks with the schools, what happens then?
I can tell you from the recommendation, it's at least 2 weeks, and we want to see how things develop. If you have spring break that third week, we're asking people to go ahead and take those 3 weeks. We've got to see where it's going, and I believe that there ought to be preparation that it may have to be longer. And what we've got to do is what it takes. And I know we can do that as Kentuckians. And so let me close by just saying, everybody stay calm. We're going to get through it. Yes, there's going to be major disruption in our lives. There already is, and it's going to start Monday, especially for parents and for those kids. But what we are doing is absolutely necessary to protect especially the most amongst us. Okay, one more.
Okay. So Dr. Fauci today admitted that the U.S. virus testing system is failing right now. I know you're in constant communication with Secretary Azar and Vice President Pence and the whole team, the federal government. Have you gotten any guidance about what testing looks like in a couple weeks? And also, could you envision a scenario where people are screened, their temperatures are taken at the airport or a drive-through testing?
So we wish, I certainly wish, that everybody who was even nervous right now could get tested if they wanted to. We are not there yet. And the time frame I keep getting for when that will be possible changes. My job is to deal with the reality we have on the ground at the moment. And what that means is we've got to make sure that we are using those testing resources where they are needed the most. That's why that infographic on when to seek care is so critical. Remember, this is a disease where we believe for 80% of people you're going to be just fine. Let's make sure that we focus as much as we can on those that will not be. So once again, we're going to have major disruption. We're going to have more recommendations that come. We will have some more tomorrow morning at 9. But folks, we are going to be okay as long as we take the necessary steps. We're going to continue to lead from information on this end. And those that are covering this in the media, thank you for the responsible way you're doing it. And both to those in the media doing it, to all those that are working on this, and to everybody out there, take care of yourself. Make sure that you're taking care of your physical and your mental health. We want to come out of this not just having defeated this coronavirus. We want to come out of this in a healthy place for all of us, both mentally and physically. Kentucky has faced difficult things in the past. We have always shown that we have what it takes, and we have what it takes here too. Thank you all very much.